Hi, I'm Jonah, and today I'll be presenting on global perspectives on various aspects of orthotic and prosthetic devices. I'm a rising sophomore at George Marshall High School with interest in the intersection of AI and cardiology. I'm involved in my school's robotics coding team. I'm now outreach coordinator for the Medical Science Club and I'm an active community emergency response team member. In addition, I've had the privilege to intern at Orthotic Solutions, which has led me to this topic today. My presentation will cover the importance of orthotic and prosthetic devices, barriers to access, and recommendations for better access. Orthotic devices can include braces, splints, or other supportive devices to correct alignment in the body, reduce pain, and provide support and improvement to body part function to allow for healing and correction. Prosthetic devices focus on helping patients improve mobility by replacing lost limbs due to birth defects, injuries, or health conditions leading to amputations. Prosthetics allow for more independent mobility and enhance the quality of life as well as a person's psychological and social well-being. Orthotics and prosthetics have many benefits, including relieving pain, providing stability, aligning the body, and helping one to stand. Without the help of these devices, many people would not experience something as simple as standing. Standing, which many of us take for granted, has numerous health benefits, which include helping with muscle bone development, improving circulation and pulmonary function, as well as aiding in digestion, bowel, and bladder movement. Prosthetics improve quality of life by helping the patient to move and have more confidence. The thought of having to depend on others for the most simple tasks can really impact a person's emotional and mental well-being. Prosthetics allow for the patient to independently go to work, social gatherings, places of worship, or school. The World Health Organization estimates that today only 1 in 10 people in need have access to orthotics and prosthetics. It is estimated that 35 to 40 million people require devices or rehabilitation, but 75% of developing countries do not have any opportunities for prosthetics. Only 5 to 15% of people who could benefit from devices globally actually have access to them. Demand for devices worldwide is increasing due to an aging population, obesity, diabetes, conflicts, and disasters. Areas in the world that have the greatest need for orthotics and prosthetics include Afghanistan, Iraq, Syria, Sudan, and Cambodia. These countries' past and current military conflicts have caused many life-altering injuries in their population. There are 3 categories of barriers to access that I want to focus on today. These are education, economic barriers, and finally, technology. First, education. I had the opportunity to interview Mr. Michael Malagari, who is the founder of an orthotics prosthetics practice in Virginia and Maryland. He is also the president of the Virginia Orthotic and Prosthetics Association and has regularly traveled to Belize for many years with World Pediatrics to provide his services to children who do not have medical care and access. Mr. Malagari shared that he believes that his biggest barrier to access is education. A majority of the developing countries that are in need of devices are simply not educated, which leads to a lack of trained professionals to make devices, teach people how to use prosthetics, and provide the required aftercare for the patients. The need for specialized training is a serious issue, as there are a few schools that include this in their curriculum. Not only are the people uneducated about this problem, but many of the governments do not make awareness and treatment for those who would greatly benefit from the devices a priority. According to studies, the average cost of an amputation in the US ranges from $20,000 to $60,000. Complexity of surgery, services, and technology of prosthetics make the cost of a huge barrier to access. Developing countries usually can't get the materials like plastic and metal joints, as costs are either too expensive or taxes are too much. If patients don't have the money to pay for their device, they won't be able to have access to these life-changing devices, and also the clinics will struggle to stay open due to the lack of payments. Another major barrier is the availability of technologies. Offices may not have access to all of the different machines or materials to make devices easily. Sometimes these clinics will be granted advanced CAD/CAM machinery, but because they require a consistent electrical grid and trained individuals to maintain and repair these machines, patients often can't take advantage of this technology. Many times, patients will travel long distances to these clinics only to find the doors shut because either there is no electricity around the more advanced machinery or the machines are broken. Another challenge would be if both offices in a country don't get the same amount of funding. One could have better technology leading to patients going to that office, causing the other office to close down. There are many steps that these international governments could take to support the field of orthotics and prosthetics. The governments could pay for students to go to more developed countries, get schooling and certifications, and come back to serve their native populations. A major cause of why professionals in these developing countries can't access this education is because of finances. Even if they get certification, if these new graduates don't get paid, then they would not want to be in orthotics or prosthetics. Governments need to support the field in their country by subsidizing the programs and clinics as they develop in order to ensure sustainability and equitable access to all communities. There are multiple NGOs that help and provide training, recycled devices, or 3D printed ones to other countries. NGOs could continue to help set up schools and develop self-sustaining programs. Creative sustainability for in-country clinics will be very important to help lower costs and keep these places running. Recycling old prosthetics and orthotics is a huge help to countries that can't easily access the materials to make these devices. However, NGOs that go down to help recycle old braces and refit them must have follow-ups with the people they help, as well as passing down a standardized practice of combining old technology with the new. Some clinics are also creatively keeping their doors open by creating different revenue streams. Internet cafes have been opened in Nicaragua and Vietnam and have been successful enough to fund one prosthetic limb a month for a person in need. While another clinic in El Salvador has found some success by producing components to sell to other clinics. There are many new technologies being developed to help make these devices more accessible. It's important that the developing countries connect with other outside international resources and organizations that can support the growing field. However, the application and review process for these grants need to be streamlined to make the access to funding easier. 3D printing, low-cost materials, and telehealth solutions for prosthetics are helping to lower costs and become more accessible. In conclusion, the field of orthotics and prosthetics have come a long way from where it started. New countries' orthotics and prosthetics programs are flourishing. Many NGOs are helping with this field in developing countries. However, demand for prosthetics is continuously increasing as we have more conflict, disasters, and disease globally. It is critical that we collaborate to help give access to orthotics and prosthetics to all communities around the world. I've listed my resources below. Thank you all for your time and interest in my presentation. I'd like to thank the Johns Hopkins Global Health Leaders Conference for this opportunity to present as a student speaker. I'd also like to thank Mr. Michael Malagari for teaching me about this field and allowing me to have great hands-on experience. Thank you to Sofat Suong for sharing your knowledge and experience with this field, my biology teacher, Miss Jennifer Holder, for inspiring me with science endeavors, and finally, my families for always supporting me. Please contact me if you have any additional questions via my contact information listed below. Many thanks.